scientific method and medicine have not always worked well together. This can probably best be illustrated in the history of the study of infection. Now, historically, some doctors and medical professionals have strived hard to improve the care and treatment given to patients, but others have not. This may be due in some measure to the time and effort that's gone into their training. Once their training has been completed, they are the acknowledged experts in the field, and to question their knowledge is akin to questioning their whole competence. Even today, among some doctors, this God complex is probably the greatest barrier to the improvement in medical care. Now, from the ancient times to a few hundred years ago, most countries did actually have extensive training for doctors, but this training was generally passing on what was assumed to be the wisdom of the previous generation. There was little attempt at scientific study of how disease worked, or even study how effective the various treatments for particular illnesses might actually be. Now, it wasn't until 1847, in the work of Ignaz Semmelweis, a Hungarian physician, that the cleanliness of doctors was even thought to be a serious issue. Now, he discovered an issue with what was known as childbed fever at 2 clinics in Vienna that he was responsible for. Now, the first clinic had approximately double the mortality rate of the second clinic. Clinics admitted patients on alternate days for underprivileged patients in an attempt to prevent the killing of newborn children by their parents, which was considered to be an issue at the time. The treatment was given free in exchange for the training of the medical staff in the practice. The problem was so bad with the first clinic that pregnant women would prefer to give birth in the street rather than in the first clinic. The physician noted, however, that those women who actually gave birth in the streets also had a far lower incidence of childbed fever than those in the clinics. So, unlike some medical professionals at the time, he decided to attempt to scientifically discover what actually was the cause of the issue. The patients were the same at both clinics, as were the actual medical methods used at both locations. Ignaz ruled out even overcrowding as an issue, since the second clinic, with its actual better record, was actually more overcrowded than the first. The only noticeable difference between the two establishments was that the first was used for the training of medical students, whereas the second was used for training midwives. He reasoned that there must be something in the training that was actually causing the problem. Now, he also noted that a doctor had been injured by a scalpel on his finger during an autopsy, subsequently died, and as a result had symptoms that were somewhat similar to those of the childbed fever. The link then became apparent. The students in the first clinic who conducted autopsies would also come into contact with the women who developed childbed fever. As a result, Ignaz came up with a theory of cadaverous poisoning, where something was being carried from the dead bodies by the doctors to the pregnant women, and causing them as a result to fall ill. He also noted that soap and water could wash off the visible traces of an autopsy, but the smell would linger around for days. But if things were washed in chlorinated lime, the smell disappeared. So, in order to reduce contamination, he instigated chlorine washes for the hands of the doctors. Then he broadened out the washing of all of the surgical instruments. As a result, the incidence of the disease dropped by 80 to 90%. Now, weirdly, his results were rejected by the mainstream medical fraternity as being unscientific. These rejections were based upon what they regarded as a lack of evidence, possible random variation, or even how could something as small, not being removed by soap and water, possibly kill somebody. Research was even rejected due to being improbable and shoddily researched. This reaction slowed the adoption of cleanliness routines which could have saved thousands of lives. Now, it must be said that at the time, little understanding about the activity and existence of bacteria actually was understood. There was actually a germ theory proposed by Girolamo Fracastoro in 1546. He was an Italian physician and an all-round intellectual who thought that disease could be spread by spores, either direct or indirect contact with infection. He thought if an infected person would come into contact with clean bedding or clothes, that bedding, the spores would be actually transferred onto it, and then from that material we then transferred to a healthy person. So it wasn't actually the direct contact with the disease, it was contact with the spores that catch the disease. This, however, was not widely accepted. Instead, it was Galen's theory of miasma, or bad air, that was thought to be responsible for the spreading of disease. Even the naming of the disease malaria related to this theory, with mal being bad and aria being air, so malaria literally means bad air. It's sticking rigidly to this theory, even when presented with contradictory results. That's a serious problem. There is nothing worse in science than somebody with a theory. Be flexible, change when the evidence supports a change.